BJC is now the first hospital system in the St. Louis region instituting a blanket pause on all elective procedures until further notice. And other hospitals in the metro region say they're getting close to doing the same thing. News 4's Gabriela Vidal is live in the Central West End this afternoon with what medical leaders are seeing as COVID-19 cases continue to strain available resources. Gabby.
Yeah, Sam, today the St. Louis Metropolitan Pandemic Task Force says in many ways this is the nightmare scenario they feared, and they believe COVID-19 hospitalizations could double over the next several weeks if this new variant impact on the community doesn't slow down at this point in time. Now, all hospital systems are looking at postponing all or certain elective procedures that can be held off for several weeks, things like screenings for cancer patients or cardiovascular disease. Now, this is in order to help allocate staff and resources to tackle the growing number of COVID-19 patients ending up in the hospital and supporting others needing serious medical care at this time. The task force says they used to rely a lot on outside agencies to provide additional healthcare staff where needed, but even that workforce is in short supply right now. Because the St. Louis region still hasn't experienced the peak of this surge, medical experts say it could still be a month before hospitals can get back to something that resembles more normal operations.
And so we know that this surge from COVID means that there's going to be more people suffering from heart attacks and strokes and cancer cases that could have been treated earlier or even prevented. And then the other piece is our emergency departments. You know, people that are sick and injured, when they come to our emergency departments, they're really facing this tidal wave of other patients needing care.
COVID-19 is also impacting medical staffing, and some of them being sick or out because of COVID-19 in unprecedented numbers. BJC telling us today that out of their 31,000 members that work across their hospitals, roughly 1,000 were out sick today with COVID-19 or because of COVID-19 exposure. Now, coming up at Flat 5, I explain what contingencies these hospitals are doing to accommodate for staffing and resources that are in short supply right now because of the ongoing surge. Reporting live in the Central West End, Gabriela Vidal, News 4.